Well, welcome. This is the UAF Winter Healthy Living Statewide Forum regarding the COVID vaccine update. Healthy Living is a series of lectures that UAF sponsors each summer for the past 10 years. We'll continue to do so this summer, Tuesday evenings, if you want to note that. Related to the COVID vaccine, tonight's speakers are Dr. Angie Ramirez, the Chief Medical Officer of Foundation Health Partners in Fairbanks, and Dr. Ann Zink, the Chief Medical Officer for the state of Alaska. I'm Mike Powers. I'll serve as a minimalist facilitator for tonight's presentation. We have many questions queued up already for Drs. Ramirez and Zink. Dr. Ramirez is the former Executive Medical Officer for Tanana Chiefs Conference and the Medical Director for the Chief Andrew Isaac Health Center previously. She has spent 20 years at Parkland Health and Hospital System in Dallas, Texas, and Dr. Ramirez currently serves as a critical lead in Foundation Health Partners' response to the COVID-19 pandemic in Fairbanks. Dr. Ann Zink is the Chief Medical Officer for the state of Alaska, is an emergency medicine physician at Mat-Su Regional Medical Center, and has served as the state's Chief Medical Officer since July of 2019. She attended medical school at Stanford, completed her residency at the University of Utah, and to put things in perspective as simply as possible, Dr. Zink has been called the Dr. Fauci of the North because of her thoughtful, straightforward, graceful, effective communications. Both Drs. Ramirez and Zink have been working tirelessly this past year in addressing the pandemic. This presentation format will take on Dr. Zink's self-described lightning round approach to answering questions. Dr. Zink will start off answering a series of questions that have been collected, and then we'll turn the program to Dr. Ramirez, who will take a second set of questions, back to Dr. Zink, and so on. That's the general format, but just to kick things off from a very high level, Dr. Zink, can you just take a minute or two and provide an overview of the COVID vaccine rollout from a state perspective?
Yeah, thank you so much. It's an honor to be here and to be speaking with you all. I always appreciate the opportunity, and anytime I get to do anything with Dr. Ramirez, it's extra special. So thanks for having us. We are in the process of rolling out vaccine across the state of Alaska. We are the most vaccinated per capita in the country right now, but that does not mean we have enough vaccine to get everyone who wants to be vaccinated as of yet. We are currently vaccinating healthcare providers, EMS, long-term care facility residents and staff, as well as those 65 and older. Essentially all the vaccines for January as well as December is allocated. There's a person and oftentimes a name associated with each and every one of those doses at the moment. So there's very few appointments available. We have been working hard on the website to make it easier. We apologize for what has been a frustrating couple of weeks for all of us, as there's been a lot of demand for vaccine when we opened it up to 65 and older without enough appointments. I think of it like boarding a plane. We called up a big group and we're still waiting for people to get on the plane. We won't leave without you, and we won't open up the next tier until we get you on board. And so we are getting more vaccine in February, and that February is all about getting those 65 and older vaccinated. So we're really excited to see what our numbers look like in February. We have not yet seen them, so we don't know how much we're getting. But we suspect it will probably similar to January's numbers because manufacturing hasn't changed significantly and we don't have another vaccine in the pipeline as of yet. That may change in March when we're hoping to have a third vaccine option in the pipeline and hoping to have increased manufacturing overall across the state. I would also just note that there's a couple real differences between Alaska's vaccine plan as well as the rest of the lower 48. So we were allowed to be like a territory. So we get all of our vaccine allotment at the beginning of the month instead of week by week. This allows us to overcome some of our large geographic challenges in the state and kind of put those weeks together. So instead of shipping out, a dose or two or a vial or two, we're able to kind of put those together and make one shipment out. It's made a really big difference in being able to get vaccine out across the state. So when you look at our numbers, we'll always look very bad at the beginning of the month compared to other states. And then we're getting that vaccine out throughout the month as we go on. We also get additional vaccine coming into the state via other federal partnerships. So the federal government did decide to give vaccine to the federal prisons, to the Department of Defense, to the Veterans Administration, as well as to IHS for the tribes. We do have 229 sovereign tribal nations in the state, and so they have their own vaccine distribution. all of the tribes in Alaska opted to come with the state for helping to distribute it. We don't decide who gets that vaccine, but based on how many people are in their tribal health organization, their THO, we send vaccine out to those regions, and each THO is using it a little bit differently on how they want to prioritize it. So think of us as the Amazon delivery service for that vaccine. That we have those numbers up on our dashboard because we are aware of them and we're helping to ship them out. The numbers that are not on our dashboard include the VA and the DoD because we're not involved in shipping those out. And honestly, we don't know how much are coming in on those. And we don't know how much have been administered. They're in a totally separate process. But we do know that Alaskans are getting vaccinated via those methods as well. And those are getting out. So we'll continue to get vaccine out as fast and fair as we possibly can. We're trying to balance equity, making sure there's equitable distribution that's logistically feasible. These are hard vaccines to get out, and that we're trying to decrease the morbidity and mortality, the death and dying associated with COVID-19. That's part of the reason for the 65 and older group. They are incredibly important, but they are also make up approximately 70% of our deaths and 50% of our hospitalizations since the beginning of this pandemic. And that's why that group is the group that we're working on actively vaccinating today. So we'll get you soon. We're getting more soon. So hang in there to all of those 65 and older. More vaccines coming, and we'll keep boarding. Thanks.
So, Dr. Zink, thanks for that state perspective. And Dr. Ramirez, your 30,000-foot view on what's happening here in Fairbanks with the rollout.
Yeah, so we were really excited when the vaccine was started to become available. And so the first tier that was accessible was the, I guess, hospital workers. And so we had it here at the hospital, and we started lining up our employees as well as anybody who was on our medical staff in any way, shape, or form who had any type of patient contact whatsoever. The reason I'm kind of sharing that is that I will tell you that day in the very first vaccine clinic, there was just such an air and an aura of excitement and hope and really just joy and celebration. And I will tell you, we haven't had that much at one time in many months. And so it was just really exciting. And since then, it has just carried on. And I think everyone's very excited to be participating in the vaccine delivery process. We did expand to doing also within the hospital setting, the EMS workers in the Fairbanks community. There are multiple different the emergency medical systems with the cities, the different communities, as well as at UAF. And rather than, it was initially trying to coordinate, the state was trying to coordinate with all of those, it was just easier to centralize that and do them at the hospital. So that is ongoing along with our employees. And then, yes, we got the notice that it was expanding to seniors, which we were really excited, but it happened really fast. Mm-hmm. And so within the community at Fairbanks, we have the hospitals continuing to do community-facing clinics at the hospital for seniors, as well as Chena Health, Interior Community, and Fairbanks Cancer Center also started doing some. And I think each one of those entities has really enjoyed doing it, as well as public health. And I think they've all been challenged, though, by the volume of phone calls. And so public health started exploratory conversation, probably just, a little bit over a week ago, was about how to do a mass vaccination clinic and whether we could come together. And so we pulled a little bit of resources to do that at the Carlson and kind of pulled what vaccine was still available and anything that wasn't actually attached to a patient name that was already scheduled so that we could get it all out as quickly as possible. I think all those entities, as well as the pharmacies, still have a little bit of vaccine left, but every single one is tied to an appointment with a patient attached and the patient name attached to it. So right now we're kind of in the position of waiting for more vaccine and kind of ready to roll as soon as we get more vaccine available. So
very good. Thank you very much. Mm-hmm. So with that introduction, we'll now begin with Dr. Zink's lightning round approach to many of the questions that are out there. If you have questions, please submit them on the live stream simply by clicking on the website link, and that is embedded in the description. So with that, Dr. Zink, would you kindly take the first series of questions queued up for you?
Yeah, no problem. I appreciate the opportunity. I will just preface this by we got a large list of questions from Mike and others, and we said, okay, bring it. Let's get the questions answered. But if you want more clarifying reasoning, please, put it in the chat box. So I'm going to go through quickly on a lot of these, but always happy to circle back if there's something else. So the first set of questions that came up with, how about if you have a severe allergic reaction to things like nuts or shellfish, should I be vaccinated at a hospital? And all of the vaccinators are prepared to be able to treat a potential allergic reaction. And nuts and seafood allergies do not consist of a significant reaction that would result in you not getting vaccinated. How about for those for underlying health conditions like 64 and AFib? Do you need to be vaccinated at a hospital? Nope, you can be vaccinated at any one of those places. If you feel more comfortable to, you're welcome to. But we've really tried to set up all the vaccine sites to work for any person. The Pfizer and Moderna vaccines, are they equally effective against the new variant? We'll continue to watch these variants closely. There's multiple new variants, but this time we do think that they are highly effective against the variant, but we're getting more data out of the UK where there's more. There's another question about vaccine safety for those who are immunosuppressed. Neither of these vaccines are live vaccines, and so they're safe in people who are immunosuppressed, who may be on cancer medication or other immunosuppressants. There's another question about if someone had COVID early this summer, can they be vaccinated? Why or why not? And we do encourage everyone who's had COVID to consider vaccinating. You could wait up to 90 days because we think you've got some decent protection for at least that 90 days and then get vaccinated afterwards. And the reason is because it looks like you have more long-term memory associated with the vaccine. COVID actually attacks part of your immune system that helps you remember the virus and attacks your kind of long-term memory. And the vaccine looks to be able to kind of circumvent that and have better long-term memory. There's another question about someone who's 75 and excellent health. Nice job. Should I give my spot to someone who's at greater risk at this moment? And in general, we just encourage you to get vaccinated once you're here. So if you're 75 and great health, this is another great way to take care of your health so you can continue to be active and moving. And what side effects have we seen with Pfizer and Moderna? What reservations do we have? And are there any unknowns? There's always risk benefit to everything that we do. Unfortunately, we're losing one person every 7 minutes to COVID-19 in this country. And the vaccine looks to be highly efficacious and quite safe. There are side effects associated with both of them. There's even side effects of getting placebo, just a shot of normal saline in your arm, including sore arm, not feeling super well. Sometimes people can feel flush, but people who've gotten the vaccine have a little bit higher chance of being sore, feeling achy, maybe feeling like you don't feel well for the next day or two. We see it a little bit more in younger people as well as on the second shot, but in general, people do well. And there have been a few cases of what we call anaphylaxis, where people get this large flushing and can have shortness of breath that's rapidly treated with a medication called epinephrine, and all of our clinics and sites are set up to be able to treat you. So with that, I'll hand it over to Dr. Ramirez.
Thank you. So my questions start off as, what if I miss my tier? And so right now, everyone's talking about how we're doing the seniors, but other eligible individuals are healthcare providers who work in the community, who may have been out of town, traveling on vacation over the holidays. They're still eligible. They still can get vaccine. You don't have to worry about that you have to get the vaccine when your tier is quote unquote called, your row. You are still eligible and you can get it whenever you can find an appointment. I hate to say that, but so no worries about it. We do want you to get it as soon as you can. And if the next question is around if you missed your second shot, the reality is, I think the best explanation I heard on this actually came from Dr. Zink herself, was that you really should plan your life around the vaccine appointment. Anytime you come in for your first dose, we're going to give you your appointment for the second dose. That way you're guaranteed to have it. You have the appointment and you get it. If you, by some chance, you were sick or you had an emergency, get it as soon as you can after that. And most sites are trying to accommodate that, but we really want you to have that appointment and just get it then. And then what about for the next question is one I've heard a lot. What about people who have problems accessing the website and are having difficulty registering? So there's several different options. So the state does have a number on their website that you can call. Right now it's leave a message and somebody will call you back. My understanding is there are plans to add a live person to answer that very soon in the future. We know that's a lot better for anyone. It's a lot easier. What I can tell you here in Fairbanks, for seniors, please do call the Fairbanks Senior Center. They have volunteers and they are maintaining a wait list. And when the Craftsman Center slots, all those appointment slots opened up, what happened was Darlene at the Senior Center had 10 different volunteers from the community come in, and they essentially registered almost everybody off of that wait list for those individuals. I know here at the hospital as well, if you want to email FHP community feedback, we've also maintained a wait list for at the end of a vaccine day. We don't want to ever waste any shots. And we've been able to call people and just kind of register them real time. So there are different people in town who are kind of helping accommodate in those situations. And I have one more. So I have a question about greatest concerns with the vaccines for pediatric patients. I will say for myself, and Anne may want to chime in here, really no concerns other than that we really don't have vaccines indicated for kids yet. It's only because it hasn't been studied. And right now, I believe it's the Pfizer vaccine we can give for adolescents who are 16 and over. And otherwise, the Mrna is adults. No concerns at all for seniors, and we're really recommending it for everybody. We do encourage you to, if you have any questions or concerns, to speak to your physicians. But we have our OB physicians are recommending it for our pregnant patients and our breastfeeding patients, but please do consult them. And again, we're recommending it for people who have a lot of underlying medical conditions. So again, talk to your physician, but it is strongly recommended. At this point, I'll turn it back to you, Dr. Singh.
Great. So I got some more questions about vaccine hesitancy and strains. The first one is, can I explain the new strains? So this is an mRNA virus, and so it's a single strand, it's an RNA virus, excuse me, and it's a single strand of this RNA. And every time it replicates, it has a chance of not replicating perfectly and mutating or having a change. And this is pretty common with many viruses, but also this coronavirus. And we have seen numerous changes in this virus throughout the pandemic. And we've seen a couple strains that have come up that look like they're more transmissible. They're easier to move from person to person, which is actually a really big deal, because if it's easier to move person by person, it takes more work on all of our part to not move it from person to person. And if more people get it, more people can be hospitalized, more people can die. And for that reason, and actually a more transmissible virus is actually more deadly than a virus that makes you sicker, not to you as an individual, but to a population as a whole. So for that reason, we are concerned about these viruses. That is another reason to try to minimize the spread and get this virus to settle down, is to give it less chances to replicate and less chances to kind of escape our immune system or even the vaccine. So that is the different strains that we see. Can you describe vaccine hesitancy? How prevalent is Alaska? Any suggestions on how to address it? People have different reasons for being hesitant, and I think it's great to ask questions and make sure that it's right for you. I really encourage people to take a look at the primary science and be careful about the sources that you look at. There's great New England Journal medical articles specifically on the Pfizer and Mrna vaccine, and talk through it. As Dr. Ramirez mentioned, talking to your healthcare provider about if it really makes sense for you. Again, these are incredibly safe and incredibly efficacious vaccines. We want to make sure that people have that option to take it. There's no plan at the state level to mandate vaccines at this point, but I really encourage people to think about the risk benefit. And when we're thinking about how many people COVID is unfortunately killing in this country right now, this is very exciting to have a vaccine that's healthy protective. Those of us who've been working on the front lines seeing patients, I mean, it was emotional when people were getting vaccinated to have a protection. And when you see this day in and day out, having the option to be able to be vaccinated is a pretty powerful option. And so really excited for more people to have that option. There's really no difference between the Mrna and Pfizer vaccine. They're very, very similar. The data is very similar. So there's really no preference. I was happy to get either one as soon as one was available. And the reason for the 2 shots versus the 1 shot is because it's kind of like a second look. The first time you get it, it's having like one look at the virus and you get a little bit of good memory, but to have that long-term memory, having a second look. So if you look at the phase 1 trials that really looked at the innate immune system, the T cell response, it was much better when you had that second look. And so that's the reason we're sticking with a 2-dose regimen, and those 2 doses are coming. So don't worry about that, despite what you may have read or seen or heard. They are coming to the same place that you got your first dose overall. And that's the reason for the 2-dose and why we think it works better than being just exposed once. The other thing, as I mentioned previously, is the vaccines appear to help your immune system long-term remember it, rather than the virus, which appears to partially attack part of your body's ability to make that long-term memory. So that's why it's a little bit better than the virus itself. What's the current scientific thinking regarding variants and future variants and recommended steps? The recommended step is to reduce transmission, because the less this virus replicates, the less chances it has. Along those lines, however, I would say that we really want to keep these variants out of Alaska as long as possible. So we're really encouraging people to follow the CDC travel guidance, getting tested 1 to 3 days prior to travel, staying home for 7 days after travel, and getting tested 5 to 7 days afterwards. By doing that, if you accidentally pick up one of these variants from the lower 48 and bring it in, then you stay home for a bit of time and get better, but then your whole community doesn't get it. And so we are doing a lot of sequencing of these to see if we can find it. We haven't found them yet, but we're asking all Alaskans to really lean into those travel recommendations right now to keep it out as long as possible while we're waiting for more vaccine to come in. And then can I discuss the transmissibility of a complex testing? How often is the virus not picked up in 2 to 3 days? It's a really great question. So we do see a lot of this virus transmitting from person to person who don't have symptoms. And I think that's been one of the most challenging things. None of these tests are perfect. So you can have PCR tests and antigen tests that may pick it up or may not pick it up. And I think that's led to a lot of the confusion. In general, the PCR tests are kind of a more accurate test to look at it, but putting it into that whole context can be really important. And if you were exposed 2 to 3 days ago, there's a decent chance that you won't pick it up at that time. The incubation period is 2 to 14 days. Really by about day 7, you're picking up most people who have been exposed to the disease. So if you traveled or if you had a big exposure, getting tested somewhere around day 7 is going to be your ideal time to pick it up. To be super safe at the end of that 14-day period is even better, but you're going to get most people somewhere between day 7 and 10. So that's why we kind of recommend that time frame. But at day 2, you're going to miss a lot. So with that, I'll hand it back over to Dr. Ramirez.
Great, thank you. So my next question is about when are we going to have another open vaccination clinic like we had at the Craftsman Center? So we're in active conversations this week. We are hoping, and it's going to depend upon timing of getting the vaccine and working through some numbers, but we are hoping tentatively to have something hopefully by similar to what we had before, but at the first week of February. And so again, that would be a partnership with public health, FHP, as well as lots of community volunteers. It's really about bringing all of our community resources together. As soon as we know for sure about getting the vaccine and that we can have those arrangements, that will be released in a press release. We will be having the second dose clinic the weekend of February 12th, because we have to accommodate everybody coming back for the second dose. So we will have that mass vaccine clinic. Homebound patients in Fairbanks who can't get to a vaccine clinic like that, right now asking everybody to call the Fairbanks Senior Center. They are maintaining a wait list for homebound seniors as well. And public health is planning with the next allotment, with the February allotment of vaccines, to make arrangements for a mobile clinic to be able to get to those individuals. The reality is, as much as we'd like to get to everybody that way, given the volume of vaccines that we have, anybody who can and has transportation, we are asking to come in for an appointment. But if it is not possible physically, again, call the senior center and get on that list, and we're making those arrangements. There's a question about private assisted living facilities in Fairbanks. And the current discussions right now, same answer. But in this case, it's either the senior center or FHP community feedback at foundationhealth.org. And the plan there is we're working with our pharmacy program at the hospital is setting up some mobile delivery type settings. So again, we're kind of coordinating amongst public health, ourselves, and the senior center to make sure we can reach each one of these entities. But again, these right now are wait lists, and then it'll be with the February allotment of vaccines. We don't have any more this month to be able to do that, but that's all in the planning. And then the last question I have here is, can I speak to about elderly patients who might be downright scared of the vaccine, of getting it? And we've heard this from some people, and we've heard it from folks who've actually come to see us to get the vaccine, and we've heard it from people on the phone and wanting to know what they should do. And I have a couple, and so I'm going to take a minute here because I think this is really important. So first off, it's normal and it's natural, and don't want anybody to feel concerned or embarrassed or worried about, whether it's okay or not. It's normal to feel scared about something that's new. The reality, though, is a lot of people have felt scared or had questions, including some of our providers. And what happened, though, is as they learned about it, looked at the research, listened to Dr. Zhang and other experts. What we've come to understand is this is very safe. It's gone through all the same processes that any medical treatment has gone through in terms of the studies. We don't know the long term, but we do know that COVID has had serious impacts on our community, and we are still seeing those. We are still seeing people in the hospital here, and we are still, unfortunately, seeing deaths. So even though it's improved significantly, if you're a person or a family member who's been impacted, you really don't care that the statistics have improved because you're individually impacted. So I think Dr. Zink already mentioned having the vaccine and having the opportunity to get protection is really huge at this point, and the benefit is so significant. And I think the last piece on it is the way the vaccine was made. There's no artificial products in it. I've heard there's no mercury, there's no food allergens. So a lot of people have had questions about that. And anyone who's afraid of a reaction, we are very well prepared to manage reactions. So again, and then I think the last piece would be to really encourage people to speak to their provider or any trusted colleagues or friends. So back to you.
Great, thanks. I'll add a few more things that are not in that vaccine. So again, as Dr. Ramirez mentioned, no food allergies, no preservatives, no adjuvants, no mercury, no cell cultures, no cells, no eggs, no pork. It's got the mRNA surrounded by this little fat structure, this nanoparticle suspended in some sugars and salts. And so that's what's made of it. And you can actually see the full list of exactly the names of the fats and the sugars and salts that are used. So anyway, that's all that's in them. So getting on to the next set of questions here, and I'll try to go through these quickly in a lightning-ish round. How frequently, under what conditions should worried patients be tested? It all has to do with your exposure. So if you're exposed to the public on a regular basis, we do recommend regular screening. You can take a look at the CDC website, and depending on how much in the community, it's usually once to twice a week. Or consider getting tested 5 to 7 days after an exposure, such as a gathering or some sort of place that you may have been. So some things to do to consider to make sure that you don't have it. Can you discuss what's happening relative to other infectious diseases? Our whole team is not just the Department of COVID, we are the Department of Public Health. And so we are still tracking many of those things. I was dealing with a listeria case right before coming on here, and we still track all of those other infectious diseases on a regular basis. We have not seen much flu this year. We've seen a couple flu cases, but we continue to track those and report those on a weekly basis as we have for years, and those are on our website. You want to understand why the COVID vaccine it says about 95% effective and influenza is only 45. Why, or 40 to 50%? Why is the difference? A couple different things. We see lots of different strains of influenza, and so we are trying to pick a vaccine that works against a bunch of them versus we really have kind of one main type of coronavirus. This vaccine works against kind of all the different strains. So that's a really big difference. And then this mRNA vaccine, this technology has been built for years, but it really looks like it works very, very well. And it was built to try to make a more stable platform to be able to create vaccines, both for cancers as well as vaccines for infectious outbreaks such as this. So lots of really cool technology and background behind this vaccine itself. What's the timetable for those with severe disabilities and developmental delays? It's a great question. Right now, it's really kind of age-based, unless you have kind of underlying health conditions. Encourage people to take a look at our tiers, but depending on your age, that's going to be your bigger determining factor than underlying health conditions. How long does the vaccine last if after you've had both doses? We don't totally know yet. We think at least a year, but we'll have more data as we continue to take a look at those people who got it first and how their T-cell response is mounting and how that looks. How long do I wait to get vaccinated if you've already contracted this fall? Again, you can consider waiting 90 days since you have recovered from it. Please don't get vaccinated if you're actively infectious with COVID-19. We don't want everyone else at the Carlson Center to get it if that's where you go. And so stay home if you're actively infected. But that's what we think for right now. What is being done to improve the website and registration process? Lots. That is a huge focus for ours right now. Right now, you can see the scraper that shows you appointments that are available. As mentioned previously, a call line that takes you to a specific person. The PrepMod site on the back side, we put in 76 requests to them and putting a lot of pressure to get that updated here regularly. So appreciate the patience. The biggest things, we don't have vaccine, but we're working on all of those steps in the meantime. You've had one shot and there's not enough for a second shot. What happens? We're really making sure that there's enough for the second shot as long as you go back to the same place. We do think that one shot is better than no shot, but really to get that longer immunity, it was studied for 2 and we want you to get 2. And the next question is, when do I get mine? I would love to meet you and know who you are, because then I could give you that question. So my 12-year-old daughter will not get vaccinated for some time because it's not been studied in children that long. Although those over 65 are starting to get scheduled now, as mentioned, even though we don't have enough spots for everyone in that category yet, we'll continue to work through it. And we encourage people to take a look at our tiered process as we get vaccine out. But I do think by this summer, we're likely going to have a lot of vaccine available. And so it won't be really this tiered process. It will be just a chance for you to get vaccinated whenever you get a chance. So with that, Dr. Ramirez, take it away.
Great. So I have a question around the most vulnerable Fairbanks populations at this time. And does that vulnerability shift as the vaccine is deployed? We're working with the tiers that were created at the state level. And those tiers were created based off of kind of looking at the data within the state of Alaska around who had the greatest risk from exposure to the virus. And so, as many of you are already aware, the greatest risk for hospitalizations and greatest risk for death and those types of outcomes with COVID is usually associated with greater age, but it's also associated with people who have other medical conditions and comorbidities. And some of those comorbidities are things that we take for granted every day, such as obesity and high blood pressure and diabetes, and many people have jobs, et cetera. So I think it's the older individuals who are in what we call congregate living facilities. So in residential facilities where it would be very easy for something to spread from one person to another, particularly in a setting where you can have asymptomatic infections. That's why it's so important that in Denali Center and the Pioneer Home and the assisted living facilities that we get everybody vaccinated as soon as possible. The other area of concern would be homeless shelters. And again, it's the same thing, that we have people in close quarters and that it's easy to spread, and if you don't have symptoms. Also in Fairbanks, I think the other group is I think in correctional facilities that we've found. And so in those tiers, we started off with the older ages, but then with the other vulnerability is exposure. And so, as already mentioned, if you're going to large gatherings, but for people who have to work in professions where there's lots of contact with individuals, so that even though you may be younger or you may not have any other risk factors, just because of the high risk of exposure also makes that a population that's more at risk. In the tiered approach with the vaccine delivery, that frontline essential worker category is going to be the next tiers, and education's in there as well. But until we get through the seniors, we simply don't have vaccine. And so that's where the masking and the physical distancing and keeping all those measures is so critical. In terms of social visits to long-term care and senior housing complexes in Fairbanks, that's still high risk right now. And so the reality is not everybody is immunized. And so, again, having to balance risk. Again, it's really important to have visits and contact, and we all know that, and everyone's really excited about getting to a place where visitation and more exposure can be expanded. Right now, we're not at that place yet, hoping as we can get visitors as well as residents and having everybody immunized, we can get there soon, but not there yet. In terms of hospitals and clinics and distribution sites dealing with staff fatigue. So this has been a challenge all year. And it's just really been the degree of the work. I can tell you some of the things that we've done kind of focus on resilience and self-care and really mindfulness and making sure that people have time for themselves. Another thing is really focusing on gratitude and making sure we all take time to think about what we're grateful for. It helps you, even though this has been a very stressful year, there's been a lot of great things that have happened this year. And sometimes, so we've been very intentional about that within our healthcare system about, so we've had gratitude boards and different types of activities that people have actually very much appreciated. And it really, again, helps with increasing resilience. And the other thing, though, is really making sure that staff have everything that they need to be able to do their job. Most people go into healthcare really want to make a difference. And one of the challenges with the whole pandemic and everything has been not having the resources to do it. And quite honestly, the constant newness. So the more that we can focus on having the information, having the clarity, having communication and protocols in place and the equipment and the supplies to do the job right and to do it well, that helps our staff actually come to work and be excited about their work. And then I think lastly, quite honestly, having the vaccine, it has really given a very much sense of hope and being able to make a difference. And so it's just been a great opportunity, and it has really changed the dynamic in that we can all work on something together that's really moving forward. But it has been a constant theme for us to manage. Shifting gears, the process for seniors at the Craftsman Center this weekend, and were any turned away and open slots. We did have about 5% no-show rate at the Craftsman Center. A lot of the appointments were scheduled through the senior center and through other volunteers and other intermediaries, which may have contributed to some of that because people did end up on multiple different wait lists over time. We're trying to coordinate that better going forward. In terms of turning people away, couples, we didn't have a lot, but a few, so a couple recommendations that are now kind of like in the screening processes. If people have been vaccinated with another vaccine in the past 2 weeks, we're recommending that they may want to delay getting the COVID vaccine. Again, it's kind of dicey. We don't want to delay getting the vaccine, but we want to make sure that it works as well as it can. If people have had the monoclonal antibody treatment, we had a couple folks who had that. The recommendation is to wait 90 days. And so I think since the Craftsman Center, because we had 2 people show up who had that, we've contacted everybody that we've given that treatment for so that they understand it's a 90-day wait. So we're hoping that we don't have that again. And I think there was one person that was turned away because they were supposed to be on quarantine at home, and gave them an appointment to get the vaccine at another date and time. I think it's back to you, Dr. Zank.
Awesome. Sounds good. Thank you so much. There's a question about, can I describe the work that's been going for years and the hurdles to get the rollout so quickly? I often describe the vaccine as kind of like my phone. It builds on technology. We wouldn't expect to start over to ground zero. This is not your grandma's vaccine. We've building on hundreds of years of vaccine technology and immunology to get to the point where we are. And that's why it's going faster. Also, this is what happens when the entire world puts a lot of money, time, focus, and energy into doing something. There's been a lot of all of those things going into there. Yeah. The other day, it was 83 days from the day that the sequence of this virus was uploaded from China to the first vaccine went into a human. And so really short period of time. And since that time, we've been doing a lot of watching and seeing how it's been going and understanding and modifying. But it's been fascinating to watch the science behind this. I kind of feel like it's like watching a man land on the moon. It's been one of the coolest experiences of my life, watching the science and technology behind this vaccine be able to come forward, and just really impressive science behind it. So I could talk forever about that one, but I won't, because there's more questions to come, but it's great. Can I highlight the phases of the rollout and how the planning was done? A couple comments about this. I think Dr. Ramirez did a good job talking about kind of where the phases are and how we'll move to the next phase. Again, we need to know what these vaccines show before we can really say who they're good for. So we didn't really make the phases until we saw the data to see if they worked as well for older people as they do younger people. A 2-year-old is really good at building an immune system, and that's why they lick your shoe and put everything in their mouth. It's because their body's like, how about this virus and how about this bacteria? And their body's like all designed to make a good immune system. But as you get older, your immune system starts to kind of tune off and not get so excited about things anymore. And so that's why we have to use high dose flu vaccine for people who are over 65 for flu. So we didn't know how these vaccines were going to work in older adults, younger adults, and what this would look like, how effective it was going to be. We're very fortunate that both of these vaccines look highly effective in both younger and older adults. And because of that, we really prioritize long-term care facilities and elders. But that decision didn't come until mid-December when we got the data to see that that was really who was going to look for. So we had to completely pivot our plan and move that direction. So we'll continue to work through the tiers that we have on, but I will just throw the caveat out there that if we get another vaccine in there that looks like it works way better for younger people, or it works better with people with 3 left feet, like that is the vaccine that we will recommend it for, because we want to follow that data and science. And so there could be changes in that. And some of the upcoming vaccines are just single dose vaccines, which for certain populations make a really big difference. And so we may have some recommendations based on that. So while these tiers are there, just know that they could change quickly based on the data and science and where we're at. Can I speak to the availability of the vaccine in the days and months ahead and how much advance notice? As you might have heard just previously from Dr. Ramirez, we did not give much notice on the 65 and older. There's a lot of scrambling. There's many reasons for that, and that would be a good fireside chat someday. But we try to give as much notice as we possibly can. Part of it is we don't know manufacturing, we don't get a notice from the federal government, and we don't know what the uptake's always going to look like. So there's a lot of interest in 65 and older. So we'll continue to board this lane until we've got most of them on board. So we'll stay here until we get moved next. And then after that would be tier 2 and phase 1B, and we'll work through that next group for as long as we need to, as long as there's no other big changes on the federal level or with the data or science behind it that we continue to follow through. There's another question a little bit about homebound Fairbanks, and Dr. Ramirez talked a bit about that. And we're seeing across the state, public health nursing going to houses. We're seeing EMS being able to respond and go to houses to be able to vaccinate people. So lots of creative ideas there. And I just really appreciate it when the communities, and your community is a great example of people working together to get people vaccinated. And so sometimes that means, the kids taking, mom into the Carlson Center to helping them get vaccinated, even though they're primarily homebound. So, there's lots of different ways that we'll continue to work through this. Without computer access and scheduling your vaccine, Dr. Ramirez gave some fantastic local examples. I will just throw out there our number, which is that 646-3322. Again, that's 646-3322. We are making that so that you can get a live person. It's my next meeting after this is to keep working on that for tomorrow or the next day. Just try to get that done as quickly as we possibly can. There's a question about once at a vaccine site, am I assured of a second? That is the goal. So there's a lot of backward planning to make sure that second site, your job is to get to the same site that you got your first one, and your job is to schedule your second dose at the time you get your first. And then it's our job to make sure that second dose is there for you when you show up. So that is what we do from the back end. Are there limitations for giving blood after vaccination? No, thank you for giving blood. We are short on blood donors across the state, and we encourage people to continue to give blood. So with that, Dr. Ramirez.
Okay. So can I talk about the vaccination process for outlying rural areas and villages? So Foundation Health, we talk about Fairbanks a lot, but we actually hospitalize anybody from all the interior. That's our actual entire region. And so most of the interior is being handled by Town and Chiefs Conference, and they are flying vaccines out to all the villages and in the village, and they're flying out a vaccine team that goes out and spends a day and immunizes everybody. This is on top of their medical provider trips that they're continuing to do out to those regions. And they are immunizing both tribal beneficiaries as well as anyone in the community. So non-tribal members as well while they're out there. They've not gotten to every village, but the last report I heard, they've gotten to quite a few of the villages, almost all of them. And they're also, I guess the only other thing on them is they are following a different, they're not following the same tiers from the state because they're acting under the tribal. And I know they started off with the elders, and the age range has come down quite a bit since. Can I describe the wait list in the Fairbanks community? I think the main thing is on the wait list is there's no one wait list. All the entities giving vaccines do have wait lists. So one of the challenges is we have found that people are on multiple wait lists because they're trying to get vaccine at whatever appointment opens up first. The one area where we're all using the wait list is at the end of the day of a vaccine, on the day that we're giving vaccines. One thing to be aware of is if we have people who are readily mobile and able to come in on a short-term basis, we never want to give any vaccine. We don't want to waste any vaccine. And so if we have leftover doses from a vial, we are going down those wait lists and finding people that night, that evening or that afternoon who can come in. So at the end of every vaccine clinic, there's usually a few people coming off of the wait list. Otherwise, the senior center will, again, once we have more slots of a mass vaccination clinic, will then enter their wait list into that register for those appointments. What special challenges, if any, distinguish Fairbanks from other communities? I had to laugh when I saw this. So for me, quite honestly, I think the question that has been a challenge all year has been that I learned a new term this year that apparently we are a second-class borough. which means I didn't understand first class and second class, but apparently we don't have health powers. And because of how we interpret how we don't have health powers, when I would get on a call or talk to colleagues in other regions, and when we were having challenges, they would say, oh, the EMTs do that in our region. And I'd find out how they do it. And it was because the borough was doing it and the EMTs were part of the borough, or testing or something else. And it's just we're set up very differently. And apparently we chose to be set up that way. And so it's made it so that we had to find our own way on how to do things. And we couldn't follow the path that other regions were doing. So I think that was uniquely ours. Last question for me is, we're in the midst of the senior snowbird season. Is there a risk of, so challenges, the risk of somebody getting the first vaccine and somewhere down south and the second vaccine here? I think, again, we're giving the advice. You get your first vaccine, you get your appointment for your second, and you plan your life around it. I think that's the easiest and most straightforward. That guarantees that you're getting the right vaccine. We really do want you to follow up with the same, the right dose that matches the same brand, whether it's Pfizer or Moderna. That way, that guarantees it. That said, if that were to happen, and if someone had their vaccine record, we would do the best that we could to accommodate to make sure that people finish their series. And we have done that for a couple of people. I will say, though, given that we are first in the nation in terms of vaccine distribution by per capita, it might actually be the other way around. I'm not sure that people are going to get it sooner down south. So, and actually, I have heard of snowbirds who actually came home to get it. So we had a couple of those. So back to you, Dr. Singh.
Great. Thank you so much. So going through the last questions here, when will more vaccines be available? Again, we're getting monthly allocations. So kind of be this bolus. We want to do as many of them at the beginning of the month as possible, just because it's life-saving. We want to get shots in arms as fast and fair, and then it will kind of go down. We suspect similar allocations for February as we did January. There are lots of challenges to the availability and distribution of the vaccine, everything from that second dose, making sure people get both at the same places. The logistics between the cold shipment is really, really challenging. Had an interesting conversation with the Lucian chain and timing. I think it applies a little bit less to our urban areas on some of those challenges, but man, in some of our remote rural regions, it's really hard to think about timing and weather. And we've had to intercept numerous flights to be able to try to throw the vaccine in a freezer, and they're all measured by these little temperature stores. So it's a really hard vaccine to get around the state. And there's a lot of people working on the back end for logistics to try to make that happen. Fortunately, we've only had one shipment not keep its current cold temperature of 20 doses. So we don't want any to have that happen, but we did have 20, but we watched them all super closely. Better than Maine, they had 4,000 the other day. In general, can we describe Alaska's statewide experience with the virus and the communities doing better than others? I think in general, Alaska has fared fairly well. We haven't overwhelmed our healthcare systems. We are near the bottom or the top, depending on how you look at the least number of deaths per capita throughout the entire pandemic. And I think there's many reasons for that. Our percent positivity is near one of the lowest in the nation currently right now. It did peak up kind of in November, but never got to where some of the other states have been. And that's been coming down nicely. And as mentioned, we're the most vaccinated per capita in the country right now. And we could talk at length for a lot of those reasons. I think that acting quickly made a difference. And I also think that Alaskans working together is the biggest thing. I think that there's just been a tremendous partnership across the state. We may not all agree, but we all continue to try to figure out ways to work together. And I think that's really important. Can I trust my appointment? And what if I show up, there's a glitch? Always feel free to call your provider and make sure it's good to go. In general, we're really encouraging providers to not have glitches, to make sure that you can trust the appointment. And we've had tremendous partnership with people who are providing vaccines. So in general, absolutely. Life does happen. We've had a couple that have had to reschedule vaccine clinics, but for the most part, they have been going off fine. No one should be charging you. So that's the one thing. You may have to be asked your insurance, because providers can charge for insurance but you shouldn't be charged up front. So we have had to cancel one clinic based on that. So just for awareness, not with you all, but no one should charge you. Once vaccinated, what documentation is required for future travel? That's unknown. We are starting to see some countries requiring vaccination proof prior to coming in. You'll get a card. Encourage you to keep it. If you travel, you'll remember your yellow fever card potentially, and it's kind of similar to that. So make sure you keep your card for potentially international travel. How long will we be wearing masks? Great question. I think I will be wearing a mask for a really long time in the emergency department. I think that we've discovered and learned a lot about the role of transmission of diseases and asymptomatic spread and what that looks like. I have not had a cold this whole year, even though seeing lots of patients. And I think it's because there's a lot less transmitting when we're protecting ourselves. So I, in the emergency department, will be wearing it, but that's very different than kids wearing it to schools, wearing it, with friends and things like that. So I think that when we start to get lots of people vaccinated, that's really going to start to change. And once we have some more information about how much this is transmitted once we're vaccinated. Can we describe our work with federal officials in bringing the vaccine to the state? That is a great another fireside chat. I would just say there's been lots of conversation with all sorts of people. We like to make sure that the federal government understands Alaska's unique challenges and that we're here to advocate for Alaskans. So we are fortunate that we are also getting in more vaccine per capita than anyone else. But there have been some challenges in that process. The reason we're getting more vaccine isn't because of our per capita, it's because we are blessed with more veterans in the state than any other state in the country. And we also have a large military presence. And so there's separate allocations coming in for both of those. And then the tribes are recognized as sovereign nations. And so they are getting their own allocation via IHS. And we do have the highest percentage of Native people in our state. And so because of our diversity in those groups, we are blessed with more vaccine because of those federal allocations. So that is also very much helping in our distribution process. There's another question about, are some communities in Alaska more resistant to recommendations and prophylactic measures than others? And I would say, yes, we live in a beautifully diverse state with all sorts of different opinions and thoughts about it. And we see all sorts of different things happening across the state. I think it's been one of the other fun things about this job is seeing how differently every community has responded and why that is and the reasons for it. What's the acceptance rate of the vaccine in Alaska? Is it different amongst communities? And are we different than the US average? Alaska Natives in general have the highest uptake of vaccine in the country for other immunizations. And so we're hopeful that that will continue with this COVID vaccine, but we don't know that for sure. We've got some more time to go. We do have pockets of very highly unvaccinated populations in the state. And so we do suspect that those will be hard to encourage to vaccinate. I would say that in general, when I talk to my counterparts in the lower 48, we have more interest in getting vaccinated in the state than many of my colleagues, particularly in the South. That is where we're hearing the biggest challenges of vaccine and vaccine uptake for a lot of, I think, historical reasons with trust with the medical system and other challenges. So we are hoping that Alaskans continue to vaccinate and protect each other and themselves. Are there funding issues that are surfacing to engage citizens should be aware of? There's always funding issues. I guess, the public health emergency has been a really important tool to being able to get money out the door quickly. Dr. Ramirez was talking specifically about, some of the challenges of kind of a second class borough and what that looks like for testing. And so, from a state level, we ended up kind of quickly contracting to try to set up testing more, but we could only do that because of kind of some of the different emergency regulations that are out there, or getting more staff to be able to run the Carlson Center. All of these things fit within that. So I would just know that there's lots of things there and encourage engaged citizens to continue to be a part of all of that. We are getting a lot more federal dollars to help out with vaccination and testing, and we're trying to get those out to communities quickly, and we're working on that today. Can I describe the present thinking about full dose versus half dose on the vaccine? Again, we really think that the 2-dose series provides better long-term protection, less of a chance for that virus to mutate. And so we're really encouraging the 2-dose. Can I describe the magnitude of the planning effort in Alaska and the nation? Lots. I don't even know what to say to that question. It's been impressive to see on all the different levels and parts, going through the spreadsheets and charts and seeing all the different tools. It's been an all hands on deck, and there's a lot of noise in the media and the politics, but behind it at the federal and state level and local and municipal and tribal level, there are people working hard to try to get this out on a daily basis. So it's been pretty impressive. How do we address those who aren't wearing masks? I always try to address it with compassion and try to understand why and talk about the reasons for the reason that you may be choosing to wear a mask. It's a cheap, easy, non-big pharma tool that we have to protect each other. So, it's something that you can make yourself, be organic, homemade. No one else is doing it, but it's really effective in helping to minimize transmission. Can I comment on the complexities of balancing economic cost and public health demands in complicating decision-making? Absolutely. So we know that people are healthier when they have economic health. So if you don't have a house, you don't have a job, you aren't as physically and mentally well. And we are not the Department of COVID. I am not the CMO of COVID. I'm the Department of Health and Social Service. And I am the Chief Medical Officer. And our mission is the health and well-being. And your economic health is as important as your physical health. These public health tools are not against the economy. These tools are for the economy. These tools are to keep businesses open. These tools are to keep people alive and moving forward and happy, and kids in school, and to be healthy and well. So public health, it's not public health versus economy. That's a false dichotomy. These public tools are always been for economy. They've always been for health, and they've always been for being able to move as fast forward as we possibly can for healthy and well communities economically, mentally, as well as physically. Can I have any recommendations on thoughts on K through 12 post-secondary education planning? Yeah, sleepovers cause COVID spread. Hanging out in break rooms together cause COVID spread, but good mitigation plans in school really seem to minimize spread. So when you're masking, distancing, and hand washing, we see very little transmission in schools. But where we see it is we see it in sports, we see it in after-school activities, and we see it in break rooms hanging out, or when people let down their mitigation or don't do any mitigation. So you do those mitigation tools, we really see very little spread in school itself. Where do we go from here as a nation? Is there a need from a pandemic czar? I think that we as a nation are much better when we work together. And so I decided early on this pandemic that when I looked at other countries and other states that were doing well, it wasn't any certain policy. It was when people unifiedly work together to be able to find a path forward. And that has been a mission since the beginning, is to not become so set in any one policy or any one mandate, but to instead find ways that we can look at the data and the science and collectively work together. And I think that's something that Alaska has been really striving for, and I think has helped us throughout this process. What are the biggest global epidemiological thinkers saying about the future of acceptance rates? I think there's concern about like how much uptake there will, but I think because the vaccine is so highly effective, I think that there's a lot of optimism. If we had a vaccine, I think one of my biggest fears in this pandemic is we would get a vaccine that was 40 to 50% efficacious. It was okay, but it was going to be really hard to get up here in front of you all and say, like, I really think this will help. I'll be like, it can help a little. That's not a really fun platform to be on. And that's what I really thought was going to happen with the vaccine. But having good data makes uptake easier, because it makes it much easier to really just speak to what it is. And it's a highly efficacious, highly safe vaccine. So I have to tell you, it was a huge relief for me when I actually saw the data and the numbers myself and saw these papers. It was probably one of the biggest reliefs of the pandemic, honestly, for me, of being like, oh, wow, we have a tool. And then to see my colleagues, friends, family, elders being vaccinated, it's been emotional and amazing release. So with that, 1 minute over, it's back to you.
Absolutely remarkable. 70 some questions were handled in the last 50 minutes. I have one more relatively specific question that came in, and then just a couple of general questions. Legal responsibility, has that come up? Who is responsible if harm is caused? Has that?
By the vaccine?
Yes.
Okay. Yeah. So it's a great question. The Panic Virus is a great book if you want to read more about legal harm and the rest of it. But essentially, there's kind of a federal program that's been set up for vaccine and vaccine harm, including a compensation plan. So it's not that no one is liable. It's kind of the federal government is liable in a very similar way that the federal government takes responsibility for VA, DOD, and kind of federal IHS healthcare delivery. It's a similar sort of process. So the malpractice is kind of handled cumulatively rather than on an individual basis. So there is a liability protection as a part of that.
Truly remarkable. Thank you very much. 2 wrap-up questions. Dr. Ramirez, what are you most proud of as you think of the community's COVID response thus far?
Oh, okay. Try to do this quickly. I think the main thing is about how the community really came together. And I have a couple of examples as I think about it. Like, so early on, when it was really concrete and we needed supplies and things like that, UAF stepped up really quickly around hand sanitizer. And we had what we call golden heart masks all throughout the building that we used and we relied on for months. And again, we barely even had to ask, and it was just kind of provided for us. Another framework of that was, I think, the medical community. And we had physicians played a huge role in our response, and educating, working together across all the different entities. That's one of the things that I have always throughout my career have heard from patients, that a complaint that, well, this doctor said that, but why are you telling me that? And someone else said that. So you guys don't know what you're talking about if I get a different answer. We had ongoing meetings, constant communication across all the private entities, as well as Foundation Health, as well as TCC, so that we could all stay on the same page and learn together and share information as quickly as possible, as well as we had a lot of physicians participate early on with community businesses in terms of how to do mitigation, as well as educational talks and videos to groups and schools and sports. And now around the vaccine, we have a lot of physicians volunteering to do videos for our own staff as well as community. So again, just seeing all that coming together. And then I think the last example I had was really, particularly at the hospital, we got a lot of feedback around our visitor restrictions early on. And they were not well understood. And we didn't know, and we had to do it very quickly, like everybody did. And we got a lot, when I say feedback, a lot of complaints. And it was very challenging. But we had some that were just really people who really shared what it was like for their loved ones and not being able to see and all the impact. And we kind of really looked at our processes and did a lot of research and kind of partnered and ended up, coming down to something probably about 4 or 5 months ago where we allowed, what's going off, but allowing one visitor for everybody, no matter where you were. And that we kind of really found that it improved care, as well as you were asking, there was a question here about for our staff, what did we do? One of the things I found that was very stressful for our staff was actually saying no to loved ones and that they couldn't be present. And so making that decision, even though it was not the norm, but we kind of figured out how to do it, ended up making things a lot better for our staff as well as our patients. And it kind of felt cool and kind of being forward thinking there. Now, I will tell you again, in some of the complaints, we did have a couple of those complaints go down to the state and everything. So it took us a while to get there, but it was great that we got there. So I think through all of it was just throughout the year, kind of working together, and kind of that was just the theme and making a huge difference. And yeah. So.
Thank you. And Dr. Zink, the 73rd question of the evening. What does the future look like 1, 2, 3 years from now?
My husband taught me years ago just to show up for the climb, and you're not sure if you're going to make it or what's going to happen. And so I kind of got 3 mottos in my life, and that's my personal one. Is I'll just show up for the climb. So I have no idea. This was not a climb I was anticipating. I have no idea what 2 to 3 years from now look like. I'm just one foot in front of the other right now.
So Dr. Ann Zink and Dr. Angie Ramirez, thanks for taking the time at the end of a very, very long day, and I know it continues, in continuing to educate the Fairbanks community about this rollout. It an absolutely remarkable job in what you're doing for the state, for the community, and just this evening. So speaking for, I'm sure, the audience, please take care of yourselves. Thank you very much.
Thank you.
Thank you so
And
much.
that concludes our presentation.